Welcome back to the show. It's time for another Foundation Friday. I'm JD here with Chris from the Humana Foundation. Chris, it's great to have you in the studio.
JD, thank you, sir. Excited to be here, and we've got a lot of great stories to share today.
That's right. In this episode, we're going to be highlighting the ways the Humana Foundation is driving impact, from record-breaking participation in Double Match Day to the launch of a new research publication strategy to an inspiring team huddle in San Antonio, and of course, major disaster relief efforts in Texas and Kentucky.
It's been a big year so far, and we're grateful for the chance to reflect on the work that we're doing alongside our associates, our nonprofit partners, and communities across the country. So thanks for having me.
And I heard we just wrapped up a pretty cool event. Chris, can you tell us more about Double Match Day and why it's such a big deal?
Absolutely, JD. Double Match Day is one of our favorite days of the year at the Foundation because it highlights really just how generous our associates are. Each year, we set aside one day when donations made through the Humana Together platform receive not just a match, but a double match from the Foundation. So, for example, if someone donates $100, we match with $200, and that's a total impact of $300 going to a nonprofit that they care about. It's a great way to make your donation go further and really create a meaningful impact.
And I heard from a little birdie that this year's event broke some records.
This birdie told you right. It did. This year's Double Match Day was our biggest yet. More than 2,000 associates participated. It's our highest number ever. And in total, we saw $1.57 million donated to nonprofits in just one day. So that's the most we've ever raised through this initiative, and it really just shows how powerful collective giving can be when we all come together.
It certainly can. Now, didn't some associates also get to direct some to pretty major grants?
Yeah, so everyone who donated was automatically entered into a drawing to win one of 3 grants to donate to a nonprofit of their choice. So how that worked was 2 associates received a $10,000 grant, and then one grand prize winner was awarded the grand prize of $25,000 for a grant to donate to a nonprofit. And the grand prize winner, his name is Jerry Bayline. He's a longtime Humana associate, and he's a Louisville native. And Jerry and his wife, unfortunately, they experienced a pretty an unimaginable tragedy in 2020 when their closest friends, Leslie Prather and her daughter Ryan, they were killed in a car crash. But in response, they've helped out with the Leslie and Ryan Prather Foundation, which was named after those two who tragically lost their lives in that accident. And the foundation supports women, children, and families who are facing trauma and loss. So Jerry took the entire $25,000 grant and was able to donate that to the foundation in their memory.
That's heartbreaking and yet inspiring at the same time, and a pretty powerful way to honor the lives and help others.
Yeah, absolutely. I mean, Jerry's story really captures the heart of what Double Match Day is all about. We're trying to channel people's personal passion about things and purpose into a broader community impact. And really the fact that this donation, combined with the foundation's support, can help expand the services of the Prather Foundation in the Louisville area. It just shows the ripple effect that one person can have, and we're really proud of how that worked out.
You should be, man. And, you know, Double Match Day only comes once a year, so for those of us who missed it this year, how can we get involved going forward?
Yeah, exactly. So next year it'll come back around, but also our donation matching program overall runs year-round. So associates can give through the Humana Together platform. That's just go/Humana Together at any time, and the foundation will match those donations up to $1,000 annually. But like you said, we'll have another Double Match Day next year. I'll let everybody know once we have that date locked up, so keep an eye out for it, and we'll see if we can break the record again next year.
I'm sure we can. So listen, Chris, thanks and congratulations to everybody who took part. Amazing work by the entire Humana community.
Yeah, thanks, JD. It really is a team effort, and we're just really proud of what our associates accomplished all together.
Now, Chris, there's something new and exciting on the horizon. I hear the foundation is launching a brand new publication strategy. Explain this to me.
Sure. So this year we're taking a big step forward in how we share what we're learning, especially when it comes to health equity and research. We officially launched a new research publication strategy, and that allows us to lift up insights directly from the work that we're funding over the foundation. It's not only a way to inform our own approach, but also to support other funders and research teams who want to invest in solutions that are reflected and shaped by communities.
All right, so this isn't just internal reporting. It's meant to be shared and used by others in the field?
Yeah, exactly. So we're being intentional about putting this information out into the public space. These publications are tools for funders, for nonprofits, for other researchers, anyone who's looking for ways to approach public health research through the lens of equity, inclusion, and dignity. So we're starting with the first release in the series, and it was a report authored by 2 of our own teammates. We're really proud of this. Heather Hyden, who leads public health strategy, and Soojin Conover, our portfolio strategy principal.
And what's this first report focused on?
So the first report takes a deep dive into what equitable research looks like in practice. We took 11 projects across our research partner network, plus some interviews with 6 subject matter experts to really understand how researchers are building trust and centering community voices. Key takeaway here is that great research isn't just about data. It's about access. It's about community leadership, and really it's about dignity.
Sounds robust. Can you walk us through what that means on the ground?
Yeah, so we'll dive into this here. I'll give you 3 different takeaways here. So the report outlines the big themes that we've seen in our partners' work. Number 1 overall is expanding access and opportunity. And what that really means is that we're removing barriers to participation. We're being aware and using culturally responsive methods. And we're working through trusted community spaces like schools and churches. Number 2, we're promoting community leadership. So these projects weren't just top-down. Our academic partners implemented community engagement strategies like partnering with local nonprofits or some advisory boards where the people that are closest to the problem really help shape the solutions and really help shape the research questions, the design interventions, and they help us share the results. And then third is respecting human dignity. Our partners made sure that participants felt seen and respected throughout the research process. So that includes offering fair compensation, using compassionate communication, and really actively working to reduce stigma.
Sounds to me like this is going well beyond just traditional research, and it really focuses and really relies on relationships.
Yeah, that's exactly it. Community engaged research has emerged as a way to build trust, especially with groups that have historically been underrepresented in health studies. So this strategy helps us ensure that research isn't just being done on communities, it's being done with the communities and in service of those communities' goals.
So if I wanted to read this report, where could I find it?
Yeah, so just go to the executive summary, which will give you just a highlight of everything that we just talked about, and then the full deep dive, the full report is on our website at humanafoundation.org. And really, this is just the beginning. More publications are on the way as we continue learning alongside our partners.
All right, Chris, thanks for giving us that inside look. It's exciting to see that the foundation isn't just funding research, but really leading in how that research is done with equity at the center of all of that.
Yeah, and we're proud of this work, and really, we're just getting started.
I hear your team recently got together in person for your annual huddle in one of my favorite places on earth that I have never been to, but I've seen pictures of the Riverwalk. So tell me, where did you go and how was it?
It was an incredible experience, and yeah, you need to get there as soon as possible. San Antonio is terrific, but we were working there. Every year we set aside time for a team strategy huddle. It's really just an opportunity to step away from our day-to-day work and kind of reflect and reset and realign. And like you said, this year we were in San Antonio for a few days. We had some really good conversation. We learned a lot, and really we also got some hands-on service.
Sounds to me like a great way to recharge. So what were some of the key takeaways?
One of the most impactful moments during this team session was where everybody on our team shared their personal why. Why they do this work, what drives them, what really keeps them committed to the mission. And we went around the room and everybody shared their personal why, and it was really powerful. And it was just a good reminder that, while we all come from different backgrounds and experiences, we're all united by the same mission, and that's just helping people across the country live healthier lives.
I have to think that kind of reflection brings a higher level of connection to everybody across the team.
It really does. And people were vulnerable, and it was just a nice way to just connect, and it gave us space to listen and reconnect with the purpose behind our work. And that's really what makes this work so rewarding for us.
And you got to meet some of our partners while you guys were in town.
Yeah, so we had a really meaningful visit with USAA. That's the organization behind the Face the Fight initiative. And as you might remember, the Face the Fight initiative, it's a national coalition that's working to reduce veteran suicide. And the Humana Foundation, we're proud to be a founding partner of it. So what we got to do is we visited USAA's headquarters, and then we had a chance to meet with members of their leadership team, many of who were veterans themselves. So those conversations gave us a deeper understanding of the challenges that veterans face and really the strength and resilience within that community.
That had to have added more context to the work you're supporting?
Yeah, and so we talk a lot about listening to the communities we serve. That's kind of the heart of behind our mission here, what we're trying to do with the Humana Foundation. And this really was a real opportunity to do that. We heard directly from veterans who were leading this work, and it helped inform how we show up as partners and how we can show up as leaders in this space.
It's easy when you go to something like this to just wind up sitting in a room in meetings all day.
Yep.
But I have to think you guys didn't just do that. You probably wrapped up with some sort of volunteer event, right?
We definitely did, and we really had a great time there. It's nice to go out into the communities that you actually work with and fund. And so we spent time at our partners' facility, the San Antonio Food Bank, and they're just doing really outstanding work to fight food insecurity across the region. We learned about their distribution model, and then we toured their incredible facility. It's just massive. And then we rolled up our sleeves and helped sort and pack donations for families in need. So it was a great way to end the week, a great way to end the team huddle, just getting hands-on, just giving back and remembering what service looks like in action.
Lots of learning, reflection, and real impact. I love it. Any final thoughts as you look back on that trip?
I think the biggest takeaway for me was that whether it's through strategy sessions, visiting with our partners, or volunteering, we're always learning. And that's kind of a charge on us from our leader, Tiffany Benjamin, to always be learning. And every time we pause to reflect, it makes our work in the future even stronger. So we all as a team came back from San Antonio recharged, we were reconnected, and ready to keep moving forward in service of the communities that we support.
Well, thanks for the behind-the-scenes look, and props to your team for putting purpose into practice, sir.
Yep, for sure. Thank you, JD.
One of our most urgent areas of the Humana Foundation's work, disaster relief. Chris, given current things, this is part of your strategy that's unfortunately needed all too often.
Yeah, that's true, JD. And disasters can affect people who are already facing structural barriers to health and recovery. So that's why the Humana Foundation has a dedicated disaster relief strategy. It's designed to help quickly, to help equitably, and to help effectively when communities are hit the hardest.
Can you give me an idea of what that strategy looks like in practice?
Yeah, so each year we set aside funding specifically for disaster response and recovery. Our focus is twofold. There's immediate relief and then more so for the long-term recovery that helps communities rebuild and heal with equity in mind. So importantly, we invest in preparedness efforts, and that helps communities plan for a more inclusive and effective response before the next crisis hits. So our grantees or our partners that we work with, we try to get to where they align with our focus areas whenever possible. And at the foundation, our focus is health equity, specifically for seniors, veterans, or school-aged kids in the areas of nutrition and mental health. So for example, the Center of Disaster Philanthropy has a focus on equity. San Antonio Food Bank ensures nutrition is top of mind when food resources are scarce. So we just try to help across the board to help deploy resources quickly.
Powerful and widespread approach, and I understand you recently had to activate that strategy in a very serious way, unfortunately, in Central Texas.
Yeah, it was a big deal. Over the July 4th holiday weekend, there's the catastrophic flooding that struck Texas. It devastated communities, and tragically, it claimed more than 100 lives. Really, this is one of the most heartbreaking natural disasters we've seen in a while, and we knew we needed to respond in a way that met the moment.
And what did the foundation do in response?
So much like the examples I gave earlier with who we've partnered with, we directed $500,000 in disaster funding to Central Texas, focusing both on urgent needs and longer term support. So that includes, we gave $150,000 to the Community Foundation of the Texas Hill Country. We gave $100,000 to the Children's Bereavement Center of South Texas, which helps with children and families dealing with trauma and grief. We did $100,000 to the Center of Disaster Philanthropy. And then finally, we did $150,000 to the San Antonio Food Bank, which is already playing a vital role in feeding the displaced families. So, and then on top of that, we also have a partner, Reach Resilience, who provided $500,000 in a donation of their own, which brought the total coordinated support to $1 million across the region.
Huge show of support. And your team isn't alone in that effort, right?
No, and it's a big shout out to all our Humana associates. They really stepped up with a company-wide giving campaign. Their donations, matched by the foundation, are being directed to trusted partners in the area like the American Red Cross, the World Central Kitchen, the Salvation Army in Texas. And in just about 2 days of this program, associates have combined to donate over $14,000 to the cause. So we're really just blown away by the support from our team here at Humana. They always show up. They always show up big. And this is what it means to stand together with a community in crisis. So any associates that are listening right now, you can still contribute if you want to go to go/Humana Together, and that giving opportunity is still set up.
I just want to repeat that, go/Humana Together. Chris, thanks for walking us through that. It's a sobering topic, but it's good to know there's efforts in place to support people when they need it most.
Yep, absolutely. I mean, these moments are difficult, but they also remind us of what really matters, and that's, showing up for each other and helping communities rebuild with dignity and with strength.
You're listening to Foundation Friday. I'm now joined by 3 guests. I'd like to introduce Danielle Neveles-McGrath. She's a Chief Impact Officer. Heather Hyden, the Population Health Strategy Lead, and Soojin Conover, Innovation Portfolio Strategy Principal. Now, it's amazing to have you all 3 here. Thank you for joining me. So welcome, Danielle. I'm sure you have a lot to share, but before we get into the meat and potatoes of this conversation, can you just share a little bit about yourself and your role at the foundation?
Sure. Thanks so much, JD. My name is Danielle Neveles-McGrath, as you said, and I'm the Chief Impact Officer. And I am joining you all today from Chapel Hill, North Carolina. I've been living here now for 3 years, so it's become home. My husband and I enjoy going on hikes on the weekends and stuff. And so it's really made us more kind of nature lovers, which is not something I would have originally said about myself, having grown up in the city of Chicago. I always thought of myself as a city person. My background has been in communications, journalism, and corporate philanthropy. I really joined the Humana Foundation just over 2 years ago, bringing expertise in the field of corporate philanthropy and impact measurement. And so I was really excited to come to the Humana Foundation to help the team really build and define their first impact strategy and help them in advancing their 5 year plan towards achieving health equity in our focus areas. Glad to be here today.
All right. And how would you say you feel about Duke?
Being that my husband has worked at UNC, I certainly cannot claim to root for the Devils. I definitely would say go Heels.
I love the candor. Thank you so much. All right. Now, before we jump into everything, can you just give us some high-level details or an overview of what we're going to be discussing and how it all fits together for the Humana Foundation's overall strategy?
So from a big picture perspective, the Humana Foundation is focused on advancing health equity by removing unjust and unnecessary barriers to health. And we do that through a variety of different ways. We do it through funding grant-making efforts that help to create healthy emotional connections and to shape a healthier approach to nutrition for seniors, school-age children, and veterans. And we fund grant-making not only in programmatic grants, which are typically programs done by nonprofit organizations that are specifically working to solve those challenges around creating healthy emotional connections and shaping healthier approaches to nutrition. But we also do that by funding research. And our goal with research is to really identify innovative solutions that are going to help us to achieve health equity and improve health outcomes for seniors, school-age children, and veterans. And so we'll be joined today by my colleague, Soojin Conover, who will speak about our research grants portfolio and how she's really working with cutting-edge researchers to identify new solutions that are going to help us to improve health outcomes. The goal there being that once we find solutions that work, we really want to share and publicize that information through the researchers that we're funding. And so we really want them to shine, to be able to speak out and share about the work that they're doing. So Soojin will talk about that. And then we're also joined by my colleague, Heather Hyden. And Heather helps us with really spreading the word about the work that we're doing from a publications perspective. So I know one of the questions that you'll probably eventually ask me around JD is, what exactly is my role? What does Chief Impact Officer even mean? And really, as we think about impact from the Humana Foundation perspective, our goal is in advancing health equity is to see a world where the people that we are serving have better health outcomes and they are getting the type of care and access that they need. And so part of that through our grant making is we're really trying to find out what's working and what's not. And Heather comes in because she helps to make sure that once we figure out what's working, we really lift that up through a publications mechanism to communicate and share that with a variety of stakeholders to hopefully get them to adopt those findings. And also Heather helps us to really lift up and share insights that we're learning from our grant partners about some of the real challenges that people are facing when it comes to food security, when it comes to accessing healthy food, when it comes to issues that cause seniors to feel lonely or even young adults to feel lonely. So Heather's going to talk a little bit more later about some of those practical examples, but we're really excited to spend time on Foundation Friday sharing a little bit about our work. And I hope that gives you a nice overview for today's time.
You did a fantastic job with that overview, and you addressed a lot of the things that I was going to ask you right out of the gate. So since we've got the formalities out of the way, I'd like to just dive right in if I could. So can you tell us why impact is so important to the Humana Foundation and what you're hoping to achieve with this?
Absolutely, JD. Impact is really important because for us, while we as a grant making organization send dollars out the door every year, it's important for us to make sure that the dollars we're investing in community are really creating meaningful change, right? We don't want to just give money out there and not see that that money is changing lives. Hopefully, by the funding that we're making out in community, we will see lives improved over time, and we will start to see people improve in health outcomes. And so impact is important because it's all about creating change at the end of the day. That's really our goal. Our North Star is that we want to see more seniors, more school age children, and more veterans living healthy, connected lives. But to do that, you need a way to really confirm, like, is the work that you're funding actually working? And so that's where my role came in. I'm just over 2 years into the position, and I really spent time in this work defining what does it mean to actually create change in the area of shaping healthy emotional connections and shaping a healthier approach to nutrition. And so I spent time with grant partners really trying to understand how do they evaluate their programs. I spent time in the field talking to experts in emotional connections, or kind of more simpler way of saying it is mental health. And I also spent time talking to experts in nutrition to understand how do you measure and evaluate this work. And then from there, I put together a framework and really work with partners to measure their impact over time. And so we spend time each year as a team and with our board reflecting and looking across our portfolio. Where are we seeing impact? And that helps us from a couple different ways. It helps us to understand which programs are really the most effective at helping more people get better. And getting better can look differently. Getting better could be helping a senior who's maybe been feeling lonely. Through getting them connected with the program, they're no longer feeling lonely. They feel a part of a community. Or it could be for a kid who wants to live a healthier, more active life, but is struggling because they're not fueling their body with the right nutritious foods, giving them a nutrition education program that really helps them to learn and identify like which types of foods they should or shouldn't be eating, and see that kid eating more fruits and vegetables, fueling their body and being able to live a healthier, active lifestyle. So getting better can look different, but it's really important that we have those parameters in place so we can look across our program, see which ones are working to really help people get better over time, and then use those learnings to then try to scale more of those programs so that we're reaching and serving more people and helping them see improvement and change as well. And that's where, like I mentioned earlier, Heather really comes in because she helps us to really tie all those insights and learnings together and really to publish and share that more broadly so that others are finding out about ways to really improve health for seniors, school-age children, and veterans.
So, Danielle, you mentioned publications there toward the end. I'd like to ask, how do those publications fit into the impact strategy?
Yeah, absolutely. And so for the impact strategy, because we're trying to see change over time and we're looking for ways to help others know about what's working, we can't just within our own selves at the Humana Foundation, right, spend time looking at all this great data and talking to partners, but not share that with the rest of the world because we are only one player in this larger ecosystem, right? And so it's really important that we share with other health funders, with other people who are interested in improving health outcomes, what's really working. We have a couple mechanisms to do that through research, and Soojin will talk about that a little bit later and how her research partners are actively working to publish. But as we look at our programmatic grants, we really didn't have a way to share and more broadly lift up those learnings and insights from our grants portfolio and really make sure that as we're finding out what's working most effectively, that that's really going out into the broader ecosystem. So publications is really an important aspect of impact because it's not just learning about what's working, it's also being able to share that so you can influence the broader ecosystem to make those changes with you.
Can you share with our audience some examples of impact from your nonprofit partners?
Absolutely, yeah. So the Humana Foundation, we fund across the United States, but we primarily focus on 4 core geographies. We focus on funding in Louisville, Kentucky, where we're, of course, headquartered. We fund in Texas, Louisiana, and we fund programs in Florida. And so I want to share an example from Texas first. And this partner is the YMCA of San Antonio, who we've been partnering with now for a couple of years, specifically around funding them to do programs that are in conjunction with their food pantry, which serves people in the community in San Antonio, Texas, but also has a unique focus on senior population, so people who are 65 and older. And they've specifically worked to provide for those seniors who are getting food from their food pantry nutrition education classes. And you may be thinking, like, what exactly does nutrition education even mean? But basically helping seniors to learn, how do you cook and prepare healthy food? What technically is considered healthy food? And so the San Antonio Food Bank realized that a lot of seniors that were coming into their food pantry didn't necessarily have the knowledge to go home and make healthy meals. And so they're coupling that now with cooking classes and with teaching them about healthy nutrition. And what they have found as a really positive impact from that is that the seniors who are attending their classes, 90% of them are reporting an increase in their nutrition knowledge, which is leading them to eating better, healthier food at home, which is having them see improvement in their own chronic disease progression, whether it's their diabetes or other diet-related conditions that they may be living with. But an interesting insight that we also found in talking to the YMCA San Antonio organization was that the seniors who are in those cooking classes are also feeling more connected to the broader community, and it's giving them an increased sense of belonging, which is really important for us because that's another area that we're concerned about. And so we saw that by coupling this nutrition education component through a cooking class, we weren't only solving for their nutrition knowledge and helping them to improve in how they manage disease, but we were also solving for that sense of connection because they were really bonding with others in the class. So that was a really powerful impact and something we've been really grateful to see in San Antonio. And then I'll move to one of our partners in Louisville, Kentucky. And so this organization is called Adventurous Mind Produce Extraordinary Dreams. In short, their acronym is AMPT, so we usually call them by that. And AMPT is a Black-led organization in Louisville, Kentucky that really started out providing music programming for youth in the Louisville area. And they really found that through their programming, that music was really unlocking an opportunity to not only help students develop various goals that comes with music, but it was also helping students to feel more connected to each other and really became a great way for them to identify how they were feeling about other things that might be going on related to their mental health. And so we funded AMPT through a planning grant to help them figure out how they could potentially use their music program to not only help students with music, but to also help them with mental health. And so through that planning grant, they put together a program for how they would start to embed and evaluate the impact of their music program on helping students to feel less lonely, helping them to feel more hopeful and connected to each other and have some resiliency. And they're early now, since they've completed that planning grant, they're now in a grant with us to start implementing those practices. And while they are early, they've seen already that in conversations with students that they really are opening up with some of their instructors about these other feelings. And they're starting to see anecdotally some pretty positive sentiment from students about how the music program is helping them to feel more connected to each other, which is really positive. And we're excited to see more from them. And this is a really great example, too, of how impact is such a journey. And sometimes partners may not necessarily be able to measure what we need today, but we can work with them over time to get there. And AMPT is such a great example of that. So thank you for the question, JD.
You're quite welcome. And thank you so much for the wonderful explanation of everything that's going on. This is all really good stuff. And I like to see so many different communities being involved in this. And I think everybody would as well. I want to move the conversation now to Heather Hyden. Heather, welcome in. Can you just tell me really quickly about your work and your role with the foundation?
Absolutely, JD. So glad to be here. So hi, Humana. I'm coming to you from Lexington, Kentucky. Just a little bit about my background. I bring about 15 years of experience in public health and community development, from state government and public policy to the nonprofit sector and academia. I've seen a lot about how these systems kind of weave together to impact community health outcomes. I've also seen passionate local leaders come together to make change, whether it's policy or expanding access to healthy foods. Really listening to community at the ground level, is a value that I have that's strongly aligned with what the mission of the Humana Foundation is and our approach to developing health equity outcomes. As the lead for our publication strategy, I try to bring all these unique perspectives to the table to share the learnings and insights from our partners, to try and scale best practices into community organizations, other health funders, and into industry.
So with the foundation, it's easy to find so many things to be proud of and excited for, considering the breadth of the foundation's reach and the good that you do in communities all over America. But I want to focus on you a little bit, Heather, if I could. What's most exciting to you about the foundation's publications, new publication strategy?
Sure. So I try to think about, how this all relates to my experiences. And, when I used to work for nonprofits, it always felt like we were, what we were seeing on the ground was not really translating to what industry or key decision makers were promoting. It honestly kind of felt like we were in a time warp, like we were stuck in the future, waiting for the resources to catch up to our innovations. And with this new strategy, we can use the foundation's platform and network to propel community-led ideas into hyperdrive for greater impact. Ultimately, as we're sharing the lessons learned on the ground, including like promising practices and stories directly from our neighbors who are directly impacted by food insecurity and loneliness and social isolation, then our hope is, industry and the sector, the philanthropic sector, can be more informed and act more quickly.
Can you explain to us a little bit how you approach the publications process?
Sure. I'm a huge research nerd. Let's get that out of the way. I love data. I mean, even outside of work, I'm constantly soaking up as much nonfiction as possible. I'm just saying, for all the associates out there who want to start a trivia team, I might be a good person to have on your team.
Noted.
But in all seriousness, it's an extremely intricate process. I mean, I take a mixed methods approach. First, I dive into as much peer-reviewed literature as I can find about a topic. Then I spend literally days with the data. I look for trends and additional context and really try to think about, what stories is this data telling me? Then comes the super fun part. I get to interview our partners. I spend hours and hours listening to what our partners are seeing on the ground, thinking about how they understand our issues and what best practice they've seen really work to improve health outcomes. And then an even more amazing part of the process is I get to hear from people who are directly impacted by issues like food insecurity and loneliness. Just in the last 6 months, I've interviewed 3 seniors and 2 young people to hear directly how they navigate these issues. And right now, I just want to give a big shout out here to Myra Johnson, who helped me as a Spanish interpreter for one of the interviews that we did with an older Latino man in Florida. So big shout out there. But, after we collect all this data, and after I listen to what our partners have to say, I really just kind of go back to the literature and the data and try to kind of triangulate everything together and kind of verify what I'm hearing. I mean, it's a very iterative process. And at the end of the day, we try to center community insights for that process.
I like that you mentioned, some of the fiction stuff that you enjoy consuming while creating that balance with industry publications that you should be consuming, just so you can have a balanced approach to what it is you do. I think for all the vegetables we eat, we also have to have cake every once in a while. Wouldn't you agree?
Yes, absolutely.
So speaking to all that and everything that you said, can you just give us a few examples of what you're learning from grant partners? And are there any best practices you want to lift up?
Yes, I'd love to share what I'm learning. I'll give 2 examples. The first are the stories of two seniors who are impacted by food insecurity in Kentucky. What I've learned from their experiences is how deeply interconnected mental health is with food security. You know, what we eat and how we do it is so intricately woven into our culture and our health. You know, food should be a source of joy, but when you don't have the ability to feed yourself or your family the way you know you should, and, you know, these amazing older women, they love salads. They love healthy, fresh fruits and vegetables. You know, it really weighs on you whenever you can't access those foods and when you can't feed your body what you know it needs. And it can cause depression. You know, imagine missing out on dinners with friends because you can't afford the restaurant. You know, you miss those celebrations, that shared community over food. Or imagine your arthritis has gotten so bad that you can't cook the way you used to. So you have to rely on processed foods more. You know, that's the reality these older women are facing. And the more they can't participate in our food culture, the more socially isolated they become. You know, that's why I'm lifting up programs that take a multifaceted approach to food security. Programs that have dual goals, you know, social connectedness and food security. Soojin will talk a little bit more about one of those programs later. But I'll talk about a second example. It's from a report I'm still working on about underserved boys' mental health. I got to interview a young man in Texas about his mental health journey. What I learned is that boys aren't really calling it loneliness. They see it more as isolation. You know, Frankie, who I got to interview, shared that his friends kind of stop participating in things they love and they sleep all day when they feel this way. Also, you know, these boys are really searching for someone to talk to, for someone to listen. He talked about his other guy friends would come over to his house and share, you know, some of their mental health struggles because Frankie's mom was a safe person to listen to. So this goes back to stigmas in mental health and how previous generations, you know, need to catch up to kind of where young people are now talking about their emotions. You know, and I'll also share that Frankie had great insight into what strengthened belonging for boys. The big ones were surrounding yourself with people who understand your experiences and joining something that gives you purpose. Frankie is a leader on the Big Brothers and Big Sisters Youth Council. So his story really illustrates the importance of that community and listening. I mean, I could go on and on. I'll just let this be a teaser, but please look out for our publications coming out soon on senior food security and boys belonging.
I love that you touched on the social aspect of food because it does have an inherent social aspect. And of course, bringing it back to some of the stigmas that permeate what people think about how people see the world and experience it. So thanks for that explanation, Heather. Now I'd like to welcome into the conversation Soojin Conover. Welcome, Soojin. Can you just tell me a little bit about yourself and what you do with the foundation?
Sure. Thank you, JD. I'm really glad to be here. So my name is Soojin Conover. I'm leading the foundation's research strategy, including research grants program. My role is fostering solution-focused research to improve health equity and health outcomes for diverse communities. My background is in public health research, so it is exciting for me to serve the Humana Foundation's mission of advancing health equity in the research space. Also, I'm a first-generation immigrant from South Korea, and I love traveling and learning about diverse cultures.
I think you being a first-generation immigrant to the United States gives you unique perspective, so thank you for joining us today. What would you say is important for Humana associates to know about that research strategy you mentioned?
Sure. Our research strategy is about uncovering new insights that can lead to real-world solutions for improving health equity. As Danielle mentioned, we're committed to sharing what we learn from research with larger health ecosystems to inform both healthcare and public health professionals, including nonprofit community organizations. Ultimately, the goal is to help address health equity challenges and make a meaningful impact by using science. As a way of operationalizing the research strategy, Humana Foundation launched the Research Grants Program in 2023. Like the other Humana Foundation programs, research grants focus on nutrition and emotional health, serving underserved and diverse communities of seniors, school-aged children, and veterans. We partner with university research teams in many different states implementing innovative solution-focused studies. Our partners are dedicated to making sure the research truly addresses the needs of communities by incorporating community voices, collaborating with trusted nonprofit organizations, and engaging with community leaders in the process. This approach helps ensure that research stays relevant and meaningful for the people it's designed to serve.
Well, it sounds like you've got a lot going on there. So I'd like to ask you, are there any particular research initiatives or collaborations you'd like to share?
Sure. One of the research projects that we are supporting is about testing an intervention to improve both nutrition and social connectedness for lower resourced seniors. As Heather mentioned, we think addressing these two challenges together has potential for greater impact and scalability. For the nutrition component, older adult participants receive healthy, culturally appropriate, and medically tailored frozen meals. And what's notable about this project is facilitating intergenerational connections for emotional health. The senior participants have regular phone conversations with college student companions, and these students check in on their well-being and, when needed, help connect them to social or mental health resources. Detailed research findings will be published in the future, but so far, we heard from the research team that both seniors and students very much enjoyed conversations with each other. Older adults liked learning what today's college students' life was like and appreciated companionship and chance to share life experiences. And students valued wisdom and encouragement from senior participants. So both groups described feeling more connected, supported, and uplifted through these regular conversations.
Positive outcomes all around. You love to hear it. So given your involvement and exposure to all of these things, what learnings could you say you've gained about research and community through this work?
So majority of the research projects that we support are still in pretty early stages. However, I can share what we hear from our research partners about the community engagement piece. When you do research in community, solutions are stronger when researchers and community members design them together, rather having researchers impose them. Also, understanding lived experiences and cultural context is essential to making research relevant and respectful. For example, one of the research partners is testing an intervention to improve emotional well-being among Latino youth, and the team is all Latina researchers, and they designed the program with their community partner serving Latino youth and reflect feedback from parents and students as well. Another example about making research relevant and respectful is one partner who is testing an intervention to improve nutrition among seniors who are living in rural areas with cardiovascular conditions is designing the fresh produce prescription program based on understanding of lived experiences in the community. The team values the pride participants have, particularly in rural areas. So they designed their food pantry in a way to provide a shopping experience so participants can select produce they like. Also, food insecurity screening was not required for the program participation because the team was aware of stigma associated with food insecurity. Programs designed in relevant and respectful way are well accepted by community and helpful to program participation and retention, and ultimately contributes to science on how to improve health outcomes and health equity.
All great things. Well, I want to thank my three guests for joining me today. Danielle Neveles-McGrath, Chief Impact Officer, Heather Hyden, Population Health Strategy Lead, and Soojin Conover, Innovation Portfolio Strategy Principal. And thank you so much for listening. We'll see you next time.